I'm Dr. Sanjay Sinha, Urologist at Apollo Hospital, Hyderabad. We have gathered today to discuss about a common problem which affects a lot of people across the world, a problem which we call the overactive bladder. Now, overactive bladder, or OAB for short, is a condition in which people will have a difficulty in controlling urine. So, ordinarily when we have an urge that we've got to pass urine, we get time and opportunity to hold on and reach a toilet comfortably, and then we can go and pass urine. But somebody with an overactive bladder will have a sense of urgency and might start leaking urine even before reaching the toilet. This is a common problem. So overactive bladder affects about 15% of the general population, and especially it's common in people who are elderly, more common in people who are elderly, and women especially are more likely to leak urine, although the condition occurs in both men and women. So men are more likely to have urgency but would often be able to control urine and not leak, but women tend to have more of leakage problems when they have overactive bladder. This can be a very distressing condition, and it's a chronic problem. So once it occurs, it often will last long term, just like hypertension or diabetes, and can have a tremendous impact, a phenomenal impact on the quality of life. Clearly, if somebody leaks urine, it's a social embarrassment. This leakage can be unpredictable, so it can happen at times without any premonition. So somebody might I might be sitting in front of a camera like this and talking to the camera, and suddenly I might get an overactive bladder contraction, and I might just leak urine into my clothes. So it's that unpredictable, and that can be very distressing for somebody because it's difficult to undertake any social activities or travel and so on. So if somebody is traveling in a bus, it's difficult because you need to ask the bus driver to stop and go pass urine somewhere and come back. So it has a profound impact on the quality of life. Other than that, the urine leakage can lead to skin problems. There can be bed sore development. People who have overactive bladder will often need to get up in the night again and again, and this can have an impact on the quality of sleep. And if the quality of sleep is not good, especially for somebody who's elderly, then they tend to have less alertness through the day. So if they are drowsy in the day, they're not entirely alert, and they have another feeling of urgency, and they need to try and rush to the toilet. And at that time, especially if the mobility is restricted, then there's a real chance that they can trip and fall. And in an elderly individual, a fall can lead to a chain of events which can have very serious consequences. And you know that all across society, you see people get a hip fracture or a spine fracture because they trip and fall. And overactive bladder has been seen as a root cause, a source of a chain of events which leads to a fall and a fracture, and that can have profound implications for the life expectancy and long-term quality of life for an individual. In fact, it's been shown that people who have overactive bladder have a 30% higher chance of a fall and a fracture compared to somebody who does not have overactive bladder. So clearly, it's not just leakage and embarrassment we are looking at, it can have much bigger implications for our life. Now, if overactive bladder happens, then the usual methods of managing this problem are lifestyle change, pelvic floor exercises, telling the patient about the importance of restricting fluids, taking less amount of fluids, because it's very common in society for people to think that drinking a lot of fluids is good for them because it cleans up the systems. But drinking too much of water or too much of tea or coffee or taking a lot of alcohol can cause large amounts of urine to be passed every day, and that can aggravate the symptoms. So cutting down water intake, restricting fluids is the first and foremost step in managing this problem. Along with this, sometimes we need to add medication, and the common group of medicines that we use are called the anticholinergic medication, and these medicines act by calming the bladder down, and they interfere with some of the signals from the bladder to the spinal cord and reduce the urgency sensation. These medicines need to be taken lifelong, long term, and many people might be needed lifelong. But unfortunately, they don't work effectively for everybody. And for many people, even if it does work, they have these medicines don't always work for everybody. There are people for whom the medicine, despite higher doses of the medicine, also the medicine might not work. Then there are others for whom the medicine works, but the medicine has intolerable side effects. And these side effects can be in the form of dryness of mouth or constipation, or a warmth of the skin, or drowsiness. And as you can understand, if these side effects are there, since the condition is a long-term chronic condition, the side effects also last a lifetime, because you need to keep taking the tablet indefinitely. So clearly, for a group of patients who are not responding, or who respond but cannot tolerate the medicine, something else is required. And in such a situation, there are two other forms of treatment that we commonly that we think of. The first is a specialized treatment where we inject a medicine into the bladder wall by endoscopy. So we take the patient to the operating room, use an endoscope, a cystoscope, and then using a special injection needle, place injections into the wall of the bladder. These are botulinum toxin injections, and they work in almost 95% of people very well. But sometimes they don't work, because no treatment on earth is perfect for everything. And unfortunately for my patient, we did try this treatment last year in 2014 November, but the treatment didn't really work very well for her. But it does work for a large number of patients. So for patients who do not respond to the botulinum toxin, or for patients who have certain other conditions which make it difficult to use the drug, because every treatment is not appropriate for every patient, there we get stuck with what treatment to offer. So one of the new treatments that is now available for such a class of patients is the sacral neuromodulation. The sacral neuromodulation is, in a very simple, simplistic sense, is a pacemaker for the spine, just like you have a pacemaker for the heart. So you place a small electrode into the sacral 3, the S3 space, by a minimally invasive technique in the operating room, and then we connect this to a battery device. In the first stage, this is an external battery, and we see how is the response of the patient, whether the patient is tolerating it well, the problem is getting well controlled. And if there's a good response, then in a second stage, we place a small matchbox size battery into the buttock, so that all wires go inside the body and there's nothing outside, and the patient has the device long term within them. And this device tends to work upwards of 5 years. And through this period, any adjustments can be done by use of a small remote which we give to the patient or her family members, and that's how the thing works. And for somebody who has a severe problem which is not getting controlled, impacting their quality of life, this can be a life-changing experience to gain back control over their bladder. And so that's the treatment that we offer to our patient. This unfortunately is a very expensive treatment. All the stages put together is very costly and probably beyond the reach of the average person in our country. We were lucky enough that after requesting the company, we were able to get this product for free of cost, and by helping out from our side, we managed to do this on a much lesser cost than it otherwise would have costed. But we understand that any treatment, all of these treatments are extraordinarily expensive for a country like ours. So clearly costs need to come down over the long term. But for the time being, at least those patients who have severe problems which are not getting controlled, this can be a life-changing experience for somebody who is not able to control their bladder.